These are axial and sagittal CT images through the level of the cervical spine without intravenous contrast in a 68-year-old female presenting with trauma. On the sagittal CT image, notice already that there is an anterior-inferior fracture fragment along the C2 vertebral body, and the anterior intervertebral disc space is widened. No retropulsion of the C2 vertebral body is seen into the canal. This is an example of a hyperextension teardrop fracture, where there is avulsion of the anterior-inferior vertebral body that results in anterior longitudinal ligament compromise. This case also has a spinous process fracture at the level of C3. In addition to those fractures, if we go to the level of C2, we notice that there are bilateral pars interarticularis fractures as well as bilateral fractures of the transverse processes with extension to the foramen transversarium. These were the fractures on this case. It's important in this case to recognize that a hyperextension teardrop fracture has a high propensity to involve the central cord syndrome, which is preferential loss of motion and sensation along the upper extremity. So that's why it's important to do an MRI examination to evaluate for central cord syndrome, to evaluate the anterior longitudinal ligament, and to assess other ligaments such as the posterior longitudinal ligament and the posterior column in ligaments as well, given the fact that in this case there was bilateral pars interarticularis fractures and bilateral transverse process fractures as well. A CTA should definitely be performed in this case to rule out dissection of the vertebral arteries, as the vertebral arteries course through the foramen transversarium from C2 to C6, which involves our level in this case as well.